A general consensus is that there are 79 organs in the body, but on the show today, we'll be focusing only on one, and that is the kidney. According to the International Society of Nephrology, approximately 850 million people globally were, as at March 2023, affected by chronic kidney disease, a disease that is no respecter of age, race, sex, or geographical location. So to do justice to this subject matter is Dr. Shola Labinjo, the Medical Director of Marital Medical Center. Dr. Labinjo has been a general practitioner for decades. And on that note, I welcome you to Talking Health with Bumi. Thank you for joining us today on this show, Dr. Labinjo. We're privileged to have you here.
That's my pleasure.
So our focus today is on kidney. So as a medical practitioner, I would like you first to explain to us the importance of kidney in the body.
Yeah, thank you very much. Just like many organs of the body, the kidney is a very important organ of the body because it regulates, is a filter of a sort in the body because it filters the blood and ensure that the blood that flows within the body is in a form that ensures optimal function of all the other activities of the body. And what do I mean? The internal environment of the body needs to be maintained in a particular manner, the pH level and all that, so that the amount of fluid circulating in the body and so on has to be maintained in such a way that other functions of the body can go on optimally. So the kidney regulates the amount of fluid that you lose, the amount you retain. And apart from this, it also ensures that certain important constituents of the blood are maintained at an acceptable level. We call them electrolytes. It ensures that you don't lose too much, you don't keep in too much, and maintains a balance. It has other functions apart from that. It helps in the formation of blood in one way or the other because it produces certain things that actually promote blood formation in the bone marrow. It also helps in the health of the bone and maturity of the bone because it will produce certain things also, certain chemicals that ensures that vitamin D is produced in a form that can be used to ensure the integrity and the health of the bone. So it's a very important organ, as you can see. So it plays a very vital role in the body.
All right, doctor. So what role has hydration got to do with the functionality of the kidney?
Okay, hydration. As I said, the internal milieu of the body has to be maintained at an optimal functional level, the pH and all. So if you don't have enough fluid within your body, the organs of the body cannot function optimally. That is when you are dehydrated. You understand? It can lead to even the kidney itself can fail. That's the other extreme because there is an optimal pressure required to encourage filtration in the kidney. So if you don't have enough fluid in the system, in your system, it can lead to a collapse of the kidney. It can fail, completely collapse. But besides that, dehydration is essential because you need an optimal amount of fluid circulating in the body to maintain pressure, to ensure perfusion of various organs because the blood flows through, and then, of course, the blood consists of the red cell, the white cell, and what we call the plasma, and that one has to be fluid. Water is part of the essential component of that. So if you lose a lot of water from the body, you do not have enough to keep the pressure in the system, and the blood, I mean, just look at it in a normal, in an ordinary sense, the blood becomes more viscous, not as fluid as it should be flowing, and then a lot of waste that should normally be excreted are retained, and that is harmful for the body. So you find that hydration, to maintain the optimal amount of fluid in the body, is very vital. And it's the kidney that regulates how much you lose and how much you retain, to ensure that you have adequate a balance, as it were, of fluid. Apart from fluid, also the electrolytes.
As a doctor, what amount of daily water consumption then would you recommend to ensure a healthy kidney or to ensure kidney health?
Very good. This varies. It depends on the temperature, on the atmosphere, on the climate in the particular region, and also the season. Because when it's dry season, for example, when it's very hot, you sweat more, so you lose more fluid. So you need to replace what you have lost, in addition to the daily requirement that you must take. And when the weather is cool, you also don't lose as much by way of sweating. So, of course, the amount of fluid you need, most of the fluid you lose then is during urinating, and then when you pee, and then the amount of fluid you require might be less. But during hot season, like in the last month or two now, in Lagos area, it's been very hot, and adequate amount of fluid, like 3 liters a day. So any adult should take about 3 liters of fluid, and 3 liters within the entire day, spread over the entire day, will be a reasonable amount to take every day to maintain a balance. And if you have cause to lose more fluid, like if you have diarrhea and you are stooling excessively, you also need to compensate for the amount you are losing. That depends on how severe the stooling is, or whatever. But we sweat a lot when it's hot, and then we must compensate for that. But 3 liters is a good figure to work with at this point in time.
Oh, okay. Despite this information that you just gave, globally we have about 850 million people suffering from chronic disease, chronic kidney disease. How can these symptoms be detected early? Or should I say, how does one know when one has kidney issues? What are the symptoms?
Okay, that's fine. Well, there are different types of kidney diseases. There are very many types, different types. It could be due to injury from sports, accidents. It could be something due to patients that have pre-existing conditions like diabetes or hypertension. The kidney might not be able to filter optimally as it should be. There could be an infection in the kidney, and the manifestation will depend on which of these conditions is at play in a particular case. If, for example, the kidney is retaining more fluid than it should be sending out, you will find that the person probably complain of tiredness, and then maybe you notice some swelling at the extremities, like the feet, or by the eyes, below the eyes, just the bleb under the eye. Especially in children, you notice that, look, this is a bit puffy and all that. So the person is probably retaining more fluid than it needs to be sending out. So the kidney is not functioning optimally. That could be an early sign. The person might have complained of weakness or tiredness, loss of appetite. You could notice that it's not passing enough urine. There is a definite reduction in the amount of the urine the person used to pass. Or you could have the other extreme, where it's just continuously passing urine and it's more. So there's a change in what used to be the pattern of that person's passing urine. These are the very simple things that one might notice, that might call attention to say, look, something is wrong. I'm not feeling quite like myself. And you see a doctor.
But sometimes one goes for tests. I've heard people go to test and they come back with no kidney-related suspicion. Is it only kidney that gives such symptoms that you're talking about now? Or there can be other conditions that give similar symptoms? How can one be sure that the situation at hand is actually kidney related?
Well, if you, like I said, some of the things I mentioned, if you get me very clearly, if you notice that, look, between 6 o'clock in the morning and 12 o'clock in the afternoon or by noon, I have gone to wee 2 times on a good day. And suddenly you find that you do not go to wee until maybe 6 p.m. And when you go, there's a change in the color of the wee. It's probably brown, or it's bloody, or it's foaming, or it's cloudy. It is different from what you used to observe. That is enough reason to go and see a doctor. Something is brewing. You may not know what. And by the time they do a simple urine test for you, just in the clinic there and the outpatients, they can suspect that your kidneys are not functioning very well. So the thing is to be observant and to be able, because there could be other conditions that could lead to some of this symptomatology, like feeling tired, feeling weak is not specific, can be anything. But if you feel different, especially when it comes to things that affect your urine output, like I said, quantity, quality, I mean, change the color, one way or the other, when you begin to have that, then you should go and see a doctor. So you cannot really assume that it is kidney or it is not until you see a doctor, and then some simple basic tests are done to show whether your kidneys are functioning well or not.
Doctor, I've seen lots of children having kidney issues. This speaks to the fact that this disease is no respecter of age.
Yeah.
What are the common causes of kidney diseases?
That's right. Let's start with children, because the causes of kidney problems they are very diverse and varied. For example, some children are born with some defects of kidney. Some might have what we call polycystic disease of kidney, where the kidneys are abnormal and they are born like that. That can be a very serious condition. It's detected quite early, in childhood, and then it has to be handled. The other common thing with children, of course, is when you find that suddenly you see a child that the feet are swollen, the face is puffy, and it's not making urine very well. And even when it does make urine, when you check, because in the hospital you might have fever, it's taken to hospital for fever, people think it's malaria. In fact, quite often the parents are treating malaria at home in a child. They will now take the child to a hospital, and the doctor takes a look at the child and sees that the face is puffy, the feet are swollen. It does a simple urine test, and it tells you that this child has a kidney problem. The blood test will also attest to that. That is children. In adults, it could be anything from passing too much urine, not passing enough, swollen feet, bloated face, and getting extremely tired. And then, of course, people that have hypertension and diabetes are more likely to have kidney disease as a complication of those conditions like hypertension and diabetes. There could be an infection, especially in the elderly, where the person just continues to have a lot of temperature. And quite often in the elderly, when they have fever, one of the things that we look at is that it could be actually from urinary tract infection, which could extend to kidney infection. And it could have, it could affect the kidney if left untreated in good time.
So what kind of lifestyle must one live then to have a healthy kidney?
One is take care of your blood pressure, because the blood pressure itself can lead to a kidney disease. So a person is hypertensive, should take care of that blood pressure. Quite commonly these days, when we cook, we use a lot of seasoning. I don't want to mention names, but a number of them that are imported that we use, they are all nothing but salt. And when you take a lot of salt, it puts pressure on the kidney, because you see, the kidney has to regulate it. It has to excrete the excess just to retain enough. If you are putting pressure on the kidney, trying to do more work, and that will also create a lot of problem for one. A diabetic patient should also ensure that diabetes is well controlled, because if it's not well controlled, certainly it will complicate the kidney function and the health of the kidney. So if you look at it that way, drink adequate amount of fluid, like we said, at this period, 3 liters a day. If you don't do that, you are putting your kidney under pressure. What's going to happen? Because it wants to regulate the fluid that you require to keep within your body. So you don't excrete enough. And if you don't excrete enough, some of the electrolytes, the waste products, because you see, when you pass the urine, you are actually excreting waste products. If you take medication, for example, some of these drugs are actually washed out. They work for a particular period of time. So whatever remains from them has to be washed out with the urine. It's like the urine actually is the vehicle that washes them out. If they're not producing enough urine, it doesn't get washed out. So you retain them in the blood. The waste, because the body is constantly, the cells of the body are constantly building up and breaking down. Red cells will break down now and again. So when they break down, certain products are released, which must be evacuated. The muscles of the body, the cells are also undergoing breaking down as you are functioning. So when they break down, the waste, if you go to a building site and you break down a house, you knock down, you must cut away the rubbish. So the same way, if you don't clear this debris, they are going to stay in the body and begin to poison the system. So you've got to constantly get them. So if you don't take enough fluid, you don't have enough pressure, as it were, amount of water, the urine is not coming out, so it's not going to, you're not going to get rid of debris and toxic materials that need to be excreted. And those ones can harm your cells and cause some other problems within the body.
So, doctor, I'm certain that there are different stages, just as we have in diabetic patients. What stages, for different stages of kidney diseases, for those experiencing different stages, what options are they left with to live?
Oh, yeah, some of them are easily treatable. And like, for example, some of the infections, if it's caused by an infection, for example, if it's diagnosed, you isolate the bacteria that is causing it, you treat with antibiotics, appropriate antibiotics, and if it's clear. In many cases, especially if you report early, the person is fine, the patient is fine and recovers fully. If you are talking about some injuries that can happen to the kidney, it's an injury of some sort. It depends on the nature of the injury and the extent of it. Some of them are things that can be treated relatively easily. And if one kidney is damaged completely from an accident or from any other trauma, it may have to be removed if it is found that it is damaged beyond redemption. And if it's not removed, it's going to affect the function of the other kidney. So it's removed surgically. But beyond that, a lot of this, like in children, for example, there could be cystic kidney. Some cysts develop in the kidney. They can be treated in the hospital. There is, if you have cancer of the kidney, which is, of course, it's something that we all don't like to hear the word C word, because it's cancer, but they can also be treated if detected early, and some of them can actually be managed, and there could be reasonable improvement in quality of life, so to say. But if you have what we call chronic kidney disease, of course, that can also advance to what we call the end-stage kidney disease. That is where I talk of transplant.
So how long does it take for someone diagnosed of kidney disease to get to that chronic level?
Well, I think the question should be more of at what point do you diagnose?
Okay.
Because there are people that they get to the hospital and they are diagnosed and they are already at that end stage level.
Wow.
So it's not a matter of, once they say you have a kidney condition, you have 5 years before you, no. It depends on the cause, okay. Etiology, the cause of that particular kidney disease, the severity, how advanced it has been by the time that person gets to seek Medicare, that can determine exactly the ultimate outcome. So if what leads to end-stage failure doesn't just happen, it starts from kidney disease of one form or the other. The person is not aware of it. He doesn't seek any help, or he thinks it's something he can handle, and it goes on like that. Maybe he takes a lot of alcohol, and then, of course, or very hypertensive, or he has diabetes, and those things affect the kidney. And this effect is gradual. He did not observe at the initial stage, or he thinks he explains it by himself. He doesn't seek help. It goes on and it progresses until it gets to a point. By the time it gets to hospital, they say, "Oh no, come on, it's end-stage failure." So it is not. You can't really say that from the moment you have a kidney, if you have ordinary, I call it ordinary infection that you did not take care of, or you use certain drugs that are toxic to the kidney continuously, by the time you seek help, it might be too late to do anything except to have a kidney transplant if it is completely gone. Or before then, you do what we call dialysis. Okay. You now use what I might call artificial kidney, in the sense that your blood is passed through a machine that will purify it as the kidney is meant to do, and then it's returned to you, and you do that. There are times when, if you do that a couple of times, you take pressure off the kidney, so it's not functioning optimally. It might recover. But there are times when, even after doing the dialysis repeatedly, depending on how advanced or how severe the damage to the kidney, you may not be able to reverse that process, and you might still have to end up with a transplant.
So, doctor, let's go for a quick break. We'll be right back. Welcome back. If you're just joining us, we've been engaging Dr. Shola Labinjo of Marital Medical Center on issues surrounding kidney diseases. So, doctor, I've heard over time about dialysis. At what stage does one need to go for dialysis? This is one leg of the question. The second one is, how affordable is dialysis in Nigeria? And how are we sure that even after having gone through the rigor of dialysis, the patient survives on the long run?
At what stage should a patient go for dialysis cannot determine on his own. It all depends. You see, because when we take blood samples, we check the levels of certain parameters, certain constituents of the blood, electrolytes we call them, sodium, potassium, uric acid, urea, and stuff. You will see how much of them do you have, how much of each of them do you have in the blood. There's an optimal amount, and they should be. It means the kidneys are not pushing out enough or adequately these particular elements, as it were. So you have to help the kidney to get rid of them, and that is when dialysis comes in. So you put the person through artificial kidney, as it were, and then it helps to purify. Each time you do it, you are taking the pressure off the kidney, and if you want it to recover from whatever is causing the embarrassment, or the failure to function optimally. So you do it a number of times, and in some cases, depending on how severe or how advanced the illness is, the kidney recovers and is able to cope, and the patient, it becomes history, just goes on. Of course, you need to go for follow-up and stuff like that. But there are situations where when you do this, it still does not recover, and the patient is permanently on dialysis because it cannot, the kidneys will not recover to be able to cope with this. And when you get to that stage, of course, it's a matter of how soon can the patient have kidney transplants, because there's the issue of donor, there's the issue of affordability, there's the issue of and all that stuff, and it depends on that. But how available, I think that's your next question, is this dialysis facility? It's quite, things are better now, because in Lagos State, I can say for sure, you have facilities in a number of centers. You have teaching hospitals, you have Alasu, Louvre, you have private hospitals that have this. Yes, of course, there will be pressure, because you see, you are put on a machine and you are kept on that machine for a period of time to purify the blood for each individual. Given the population of people in Lagos, a number of those who are coming down with this condition, of course, there's pressure. So people might have to wait, and then you have 3, 4, 5, 6 people, and so on. Some of the machines might break down now and again, given government establishment. Not everybody can afford to go and have dialysis outside, especially when it's something that you may have to have 3 times a week or 4 times a week, and each time you pay. And each time you are going to have dialysis, apart from paying, you have a blood test to assess where you are before and after. So these are things that put pressure.
How affordable is it?
Well, yes, if you say so, it's expensive, and that is true. But that is the reality of it. It is expensive. And if you ask me, such services should be made available for free for people by government. But you see, and I believe there is enough resources to do that if our resources are appropriately husbanded, if we get our priorities right. But that's not where we are. So, of course, they are conflicting. They are competing interests for whatever resources we have, and especially they are not properly minded. Because to me, the health of citizens is very important, and the government should provide that, because it's not always something that everybody can afford. Those who can afford, yes, fine. But those who cannot, the government should be able to provide that for them.
Okay, you said something that is of concern to me when you talked about if the kidney does not recover. And I'm wondering, what are the factors, even after being exposed to such medical facilities and treatments, why then will the kidney not recover? What are the factors, what are the factors responsible for such kidneys not recovering from such a situation?
Simple. Like I said, is that it depends on how advanced the damage is. It depends on how advanced the damage is. This is what you are trying to do when you get the patient. The first thing is, oh, okay, these kidneys are not working well. There has been this kind of damage and so on. And each individual has his own degree of resilience to be able to cope. So you now say, okay, take the pressure of the kidney and let's see how it's going to perform. That is the way. So you do that, and you just find that these kidneys are far too damaged. They are not recovering. It's not after one dialysis that you come to this conclusion. You do a course of dialysis and you are assessing, you want to see how well it's going to recover. So you rest the kidney, and then you continuously rest and take the pressure off the kidney. You are doing this thing 3-4 times a week. And then after a cycle of it, the patient has not recovered. That tells you that those kidneys it's like beating the dead horse. So that person might have to be on dialysis. Whereas some other person After that initial course of dialysis, the kidneys pick up and you are good to go.
Wow.
Again, it also depends on what caused the damage in the first place. Apart from drugs, chemicals, all sorts of abuse, and even diabetes and hypertension can also damage the kidney to the extent that it becomes irreversible.
That is mind-boggling, doctor. Thank you so much for joining us on the show. Hope when next we call on you, you will oblige us. Thanks once again for your invaluable inputs.
Thank you very much for giving me opportunity to serve our people. Thank you very much.
I'm convinced you now understand better how vital the two fist-sized organ is and appreciate how better to take care of the tireless organs working seamlessly within your body system to make you function efficiently. So, until I come your way again, think health matters. Think talking health with Bumi. Bye for now.